you have the media making sure they're trying to destroy Republicans that are actually doing a good job. So moving on, again, to the Daily Wire. The data proves it. Florida's COVID response was superior to New York and California. So the way the states work out as far as population goes, the four most populous states in the country are California, Texas, New York, and Florida. And at this time, I'm not sure if New York has more people or Florida. It's really close. So we have all the data here that shows that Florida has actually handled the COVID crisis the best. I think they locked down for a little bit, but they prioritized seniors, and they reopened at the end of last April or the middle of last May. So they reopened last year, and they've been open and gradually been opening and opening more. I believe they've gotten rid of all mask mandates now. It's spring break time, so they are welcoming people. But just the data shows it. So the numbers don't lie on this. They have been doing better. So when you break it down, so basically by population size, according to 2019 data from the U.S. Census Bureau, Florida is among the country's most populous states with almost 21.5 million residents. Now, compared to other populous states, Florida has the largest proportion of elderly residents, with almost 4.5 million people aged 65 years or over. That means that almost 21% of Florida's population is considered high risk for COVID-19 based on age alone. We are now finding out right now that the next biggest factor for COVID deaths is obesity. So if you're old and fat, you're probably going to die from COVID if you get it. That is astounding. So in contrast, as far as the age goes, in New York, only 17% of the population is over 65 or older, and California, 15% over the age of 65. Now, according to the CDC, those aged 65 and over are most at risk when it comes to hospitalization or death due to COVID-19. Those between the ages of 65 and 74 are 35 times more likely to be hospitalized with COVID-19 compared to 5 to 17-year-olds. So the likelihood of death due to COVID-19 is much higher for those for people that are elderly. And Florida has a much higher elderly population. However, as we keep going through here, you're going to notice something is that the death rate between New York and California and Florida are virtually all the same. So Florida has a much older population, and California and New York have a much younger population, but they're basically the same. The main difference, though, New York and California stayed locked down, and Florida did not. Florida opened back up. So basically, there was almost no advantage to the lockdowns. The lockdowns end up being basically what they were supposed to do. They were meant to keep the emergency rooms and the healthcare facilities open to try to slow that spread, and that's what they were meant to do. But instead, they were used for other purposes. Now, in terms of raw count, and we'll go back to the article here, in terms of raw count, Florida has 2.1 million reported cases of COVID-19. This places them third in the nation, with California having 3.65 million cases and Texas having 2.76 million cases. That makes sense considering the population. So California has more people, they're going to have more cases. Texas has more people than Florida, they're going to have more cases. Same thing with Florida. Florida has more people, they're going to have more cases. So you can't expect 2 million people to get COVID in Idaho when there's only 1.5 million people there. So, however, when you adjust for population size, which you need to do to give a really fair comparison, the rankings change. Florida has 9,178 cases per 100,000, while New York City alone has 9,560 cases per 100,000. The rest of New York has 8,944 cases per 100,000. New Jersey has 9,749 cases per 100,000 population. So, in fact, Florida is ranked 30th, and it's ranked 39th if you exclude New York City from the New York totals. But overall for the state, 30th in terms of case per rate per 100,000 people. So North Dakota, South Dakota, Rhode Island, Utah, Tennessee, Arizona, Oklahoma, Iowa, Arizona, Wisconsin, Nebraska, South Carolina, Alabama, Kansas, Mississippi, Indiana, Idaho, Georgia, Nevada, New Jersey, Montana, Illinois, Wyoming, New York City, Delaware, Texas, Louisiana, Kentucky, and Missouri all have higher case rates per 100,000 people they basically are worse than Florida. They did worse than Florida. Now, what we're really getting at when it comes to COVID, what we should really be focused on is how many people are dying. That is actually really what matters, because we're trying to save lives. That's the whole point of this thing. We're trying to save lives. So we have this very novel virus that we didn't know what to do with. So we wanted to make sure we were protecting as many people as possible, not overloading our healthcare system. That was what we were sold last year. Now, in terms of raw count, Florida has 32,778 deaths from COVID-19. This places them fourth in the nation, with California having 57,744 deaths, New York having 49,000, and Texas having 47.5 deaths. When you again adjust for population size, the rankings change again. Florida has 152 deaths per 100,000. New York City alone has 365 deaths per 100,000. The rest of New York has 168 deaths per 100,000. New Jersey, where my parents live, my parents and my sister and my niece and nephew, they live in New Jersey. 272 deaths per 100,000. The state of Illinois has 184 deaths per 100,000. So when you compare Florida, which is effectively a red state, it's kind of a purple state, but it's effectively a red state, they are doing better. The number of deaths per 100,000 is better than almost every other blue state. So, and you have to remember too, they have the second oldest population in the country compared to these other blue states, which have much younger populations. I believe California is the fifth youngest population in the country. So if they are doing basically the same, that means Florida is doing better. Now, when it comes to vaccines, that's the end game here. So I've said this in a couple other videos. Once every adult is vaccinated, this thing is over. We're done. All right. There shouldn't be any more mask mandates. There shouldn't be any more anything. All right. COVID is over as soon as every adult is vaccinated. Or every adult that wants to be vaccinated is vaccinated. Once that's done, it's done. It's over. We're done with this disease. We should be getting back to normal. Now, according to the CDC, a total of 83,900,000 people have received at least one dose of the COVID-19 vaccine in the U.S. So that's about a little over 25% of the total population. 45.5 million have been fully vaccinated, amounting to about 13.7% of the population. Florida has administered a total of 8,250,717 doses, with a rate of 38,415 doses administered per 100,000 population. This is more than Texas and just a little bit behind California. Now, me living in California, let me give you a little anecdotal evidence here. I don't think California really knows what they're doing, because I know they prioritized a little bit the seniors and and people who are in healthcare, because a cousin of mine is a nurse. My in-laws are over the age of 65. They all got vaccinated right away, which is fine. I'm cool with that. That's great and all, but somehow, even though I'm a bit older than my wife got the vaccine. I have not been approved to get my vaccine yet. So it's a little bit weird, but I don't really think they know what they're doing. I do know that Florida has prioritized 100%. They prioritized the essential workers, basically the healthcare workers, the people that are always going to be in contact with people who have COVID. And then they prioritize the elderly. So we know that. However, you also have to remember this as well. If you're prioritizing a certain group of people rather than just giving it out willy-nilly, you're probably going to lag behind a little bit as well. Now, Florida is ahead of multiple states when it comes to the vaccination of 65 years or older, which should be the priority. elderly, and now we know people who are obese. So especially the elderly that are overweight, they should be the ones that are the highest risk. They should be the ones getting it first, and that's what Florida did. They prioritized the elderly people. Now, in this age category, basically people over the age of 65, Florida has a rate of 124,816 doses administered per 100,000. That is better than California. That's better than New York. It's better than Pennsylvania, and it's better than New Jersey. So the reality is that Florida is actually the model state for how COVID should have been handled. You can go to other states and say, well, really, there should have been never any lockdowns. There should have been no changes whatsoever. If you want to make that case, fine. I'm a little bit more of, okay, if we had lockdown for 6 weeks and then ended it, that's about it. Maybe if you want to go 8 weeks, that would have been fine too. But that's it. It really should have ended last summer. But Florida really is the gold standard for how COVID should have been handled. And of course, Democrats are doing everything they can to villainize Ron DeSantis, because if they can make sure he doesn't win re-election for governor in that state, then that completely removes him from the conversation of running for president in 2024. And if there's somebody you don't want to have Kamala Harris run against, and yes, it's going to be Kamala Harris, it's not going to be Joe Biden. I'm really at the point where with Joe Biden, and I'll go over this a little bit later, January 4th, 2023, put that on your calendar. That is the over-under date for Joe Biden resigning. That's the day after the next Congress takes office, and that gives Kamala Harris plenty of time to take over the position and get herself ready to get some big wins legislatively and then run for president. So that's what I think is that's the over-under, January 4th, 2023. They need to hurt Ron DeSantis as much as they can. They need to bloody him up as much as they can, because he is a real threat. As I've said in my previous videos, he is Trump. He's Trumpism without Trump. So all the good things that people like me liked about Trump, he is that, but he doesn't have any of the same problems that Trump has. So he is not, he doesn't have he doesn't just go on and on where Trump tries to make the same case and just meanders and says the same thing over and over. He's very clear. He's very concise. And on top of that, he's actually doing the best job when it comes to COVID. He's doing better than any other governor, any other state.